If you're working past age 65, there are 4 big Medicare traps that can cost you thousands of dollars if you're not aware of them. In this video, I'm going to show you exactly what those traps are and how to avoid them. Coming up next on Holy Schmidt.
Holy Schmidt!
If you're new to this channel, hi, my name is Jeff. I'm a CPA turned author turned public speaker, and I started this channel in 2020 really at the request of my daughter, who saw me helping family members with their finances and information around their finances, and she said, "Dad, if you can help them, can't you help other people too? The world is not in a great place right now." And with that, the channel was born. Now we have over 375,000 subscribers, over 5 million hours of watch time, over 50 million views, and we would love it if you join our YouTube family. So simply click subscribe and turn on notifications so that you get alerted the next time I post a video. I post 2 or 3 times a week. When it comes to Medicare, there are rules, there are exceptions to those rules, and there are even exceptions to the exceptions. So it's no wonder that people are confused about Medicare. This is particularly true at age 65 when people are making a lot of decisions. And if they're working, it complicates matters even more. In this video, I'm going to show you a super simple way to avoid mistakes when working past age 65, at least as it relates to Medicare. All right, let's get into it. During the working years, most people have health insurance through their employer, and that health insurance covers the big risks that an employee faces as it relates to their health. And in return for that, the insurance company receives a premium. A lot of that premium comes from your employer. Maybe some of it might come from you. But regardless, the risk, or at least most of that risk, sits with the insurance company. You're responsible for things like deductibles, co-pays, co-insurance, etc. But if the big one happens, the vast majority of that cost is going to be covered by the insurance company. That makes them what's called the first payer, meaning that they are the one that's responsible for paying the big part of the bill. And you are the second payer, the leftovers basically, on the big bills anyway. But what happens when you turn 65? Well, that's what we're going to talk about now. In order for you to understand the rest of this video, there's one super simple concept you need to understand. And it is something that happened in 1980 and then again in 1982. In 1980, Medicare was facing a funding problem. And in order to fix that funding problem, someone in the government came up with an idea. They said, listen, if somebody's working and they're 65 and older, the Medicare system should be the second payer and their group plan should be the first payer. Basically what this means is that the group plan takes the big hits and Medicare picks up whatever's left over. But there was a problem with this idea of putting it all on the employer at age 65 plus because that had never been done before. And small employers saw their health insurance costs skyrocket if they had just 1 or 2 people 65 and older still on the plan and still working. And that meant not just the 65-year-olds' costs, but everybody's costs went up. So what do these small companies do when their health insurance costs are going up? Sometimes doubling, sometimes tripling, because you have 1 or 2 people that are 65 or older on a plan that might have 4 or 5 people. Well, they make decisions. One of the decisions is, should we keep this employee? Another is, can we even afford to keep the company in business? Because we're already operating on razor-thin margins under a lot of circumstances anyway with small business. So the government, in its infinite wisdom, had what was called the small employer rule. And that basically meant that if the employer had 19 or fewer employees, Medicare remained the first payer, and 20 or above, Medicare became the second payer. And the rationale at the time was that the companies that had large staff, not just 20, but 2,000 or 200,000 in a few cases, I suppose, could absorb the cost of a few employees, 65 and older, much easier than a small group. And in real life, by the way, that's the way it pans out. Group insurance is reassessed pretty much yearly with companies big and small, and they have rate increases. A lot of those rate increases are based on claims. And if you have 2 people in a group of 200 that are 65 and older and have larger claims, that's going to have a lot less of an effect on the group than if you have 2 people in a group of 4 or 5. Now, I will say this was the early 80s and pensions were still in place in a lot of companies, and people didn't have such a formulaic view of the workforce. Today, it doesn't matter with a lot of companies. They're looking for ways to cut costs no matter what the size of the organization. Putting corporate cost-cutting strategy aside for a second, there are just two things you really need to know to understand everything we're going to talk about next. If the number of employees in the company is 19 or fewer, then Medicare is the first payer. If the company has 20 or more employees, Medicare is the second payer. Now, when you turn 65, you qualify for Medicare Part A and B. But you don't have to take Medicare Part A and B if you're working and you're not collecting Social Security. You can decline it. But the first trap is not understanding who's the primary payer and who's the secondary payer. At age 65, if you decline to take Medicare and you work for a small employer, 19 employees or less, then there is no Medicare to take the first payer position. That doesn't mean that your group plan will pick up the first payer position as it did before you were 65. The first payer position now becomes you. And this is an extremely risky position. It's not one you want to be in. So if you work for a small employer, you need to take Medicare Part A and B. Now, some people will say at this point, I'm working, but I'm not on my company plan. I'm on my spouse's plan. What do I do then? Well, then they look at your spouse's plan. If your spouse's company has 19 or fewer employees, then the same small employer rules apply. 20 or more, then large employer rules apply, which we'll talk about in a minute. Now, even though you're required to take Medicare Part A and B when you turn age 65, you can drop the employer plan and get a good Medigap plan or a Medicare Advantage plan and a prescription drug card. And a lot of people do this because they look at the benefits of their employer plan or their spouse's employer plan, and they look at the benefits from Medicare plus the supplement, and they look and they say, you know what, that's a better choice for me, the Medicare combination, than the small group plan that I'm on. And the big decisions are the triad of cost, coverage, and convenience. Cost is what's your overall cost with the employer plan and Medicare A-B combination, or Medicare A-B and a Medicare supplement plus a drug card. It also means comparing deductibles, copays, coinsurance, and maximum out of pocket on the two options to see which one is better as a package. Coverage means knowing what services, doctors, and prescriptions are covered under both options. And convenience is the practical side. How is it to use your coverage day to day? Do you need a lot of referrals and prior authorizations? Do you have multiple ID cards that you need to present? Are there different customer service numbers for different entities that you need to call to get something done? So if you're on a small employer plan, don't make the mistake of declining Medicare Part A and B because you think that you're covered and you'll pick it up later. The next mistake is not understanding what happens during your initial enrollment period. Now, your initial enrollment period is the 3 months before your birthday, the month of your birthday, and 3 months after your birthday at age 65. So if you turn age 65 in June, your initial enrollment period runs from March 1st through September 30th. The sole exception to this is if you were born on the first of the month. I tell people if you were born on the first of the month, assume that you were born one day earlier on the last day of the previous month. That makes things crystal clear in their head when they need to do what they need to do. If that's the case, your initial enrollment period would be from February 1st through August 31st. If you're born on June 2nd, your initial enrollment period would be from March 1st through September 30th. You get the point. So let's assume that you were born on June 3rd. Your initial enrollment period is March, April, May, June, July, August, and September. But, and this is a big but, if you don't enroll by the month before your birthday, then you are the first payer of the risk that may happen until you become covered. Let me explain what I mean. If you enroll in March, April, or May, your coverage starts on June 1st. If you enroll in June, your coverage starts on July 1st. If you enroll in July, your coverage starts on August 1st. If you enroll in August, your coverage starts on September 1st. And if you enroll in September, your coverage starts on October 1st. But what happens from June 1st until the day your coverage begins? Well, your employer won't cover that difference because they're the second payer, and you don't have Medicare in place. So again, if you don't have coverage in place by June 1st with the June 3rd birthday, you become the first payer until your coverage kicks in. That's a long-winded way of saying that you really should enroll no later than the month before the month that you become eligible to receive Medicare. So what happens if you work for a small employer and you miss the 7-month window? Two things, potentially two things anyway. One is that the 7-month window guarantees that you don't have to go through medical underwriting. Beyond that, you may have to go through medical underwriting. The penalty is 10% for every 12-month period that you should have been on Medicare Part B, but you didn't take Medicare Part B. And that's for the rest of your life. There's also a 1% penalty on Medicare Part D, that's your drug coverage, unless you have creditable insurance elsewhere. Gang, we are in the middle of Medicare's annual enrollment period. It goes from now until December 7th. And many plans are changing or going away altogether. There was a Wall Street article about this about 2 weeks ago. So you have from now until December 7th to get on the right Medicare plan for you for 2026. And even if you're happy with your plan in 2025, I recommend that you check your 2026 options because things change and millions of people get stuck on the wrong plan every single year. We limit our partners to 2 or 3 well-researched partners on this channel, and one of those partners is Chapter. Chapter is the only Medicare advisor that looks at every plan nationwide to make sure that you're on the right plan for you. And if you're on the right plan, they'll tell you, and if not, they'll tell you as well. Importantly, it doesn't take a lot of time, about 20 minutes. It's totally free to you, and they save their clients an average of $1,100 per year. So if you're interested, give them a call at 440-703-1224 to see if they can help. Now, what if you work for an employer with 20 employees or more? Well, the rules change, and that's what we're going to talk about now. 20 or more could be 20, 200, 2,000, higher. It's a large number. And it works the same way as the small employer plan. If you're an employee, it's the size of your company. If you're on as a spouse, it's the size of your spouse's company. And as a reminder, it's the number of employees in the company, not the number of employees on the plan. When there are 20 or more employees in the company, Medicare moves from the first payer position to the second payer position. And that means that if you have a claim, the employer's health insurance covers the bulk of the claim, and really anything left over is covered by Medicare. So putting all the rules aside for a second, if you think about this logically, if Medicare isn't the primary payer, they'll make it as easy as possible for you to stay off of Medicare as long as possible. And the reason is because Medicare wants the big employer to pay, so Medicare doesn't have to. So the next mistake is taking Medicare at age 65 if you don't have to take Medicare at age 65. Some people will take Medicare Part A and B at age 65 because they're worried about penalties. But as long as you have creditable insurance, either through your company or your spouse's company, and that company has 20 or more employees, you don't have to go on Medicare. Now, I keep using this funny term called creditable insurance. What is creditable insurance? The non-technical definition is that it's health insurance that pays at least as well as Medicare's standard coverage. And the same thing is true with your company's drug plan. In order for it to be creditable, it needs to be as good or better than Part D. In all cases, you should ask your company's benefit contact, oftentimes this is the HR department, if your plan is creditable or not. The next mistake is not comparing coverage with your company group plan with Medicare and a good Medicare supplement, a Medigap policy or a Medicare Advantage policy, and prescription drug plan. It may be more cost effective for you to drop your company's medical insurance altogether and just go with traditional Medicare and a good supplement. And I'm going to give you a financial example using the costs for single coverage because Medicare doesn't offer family plans. First is the deductible, which is between $2,000 and $2,500 annually for single coverage. Copays average between $25 and $45 per primary care visit, $45 to $75 for specialists, and urgent care copays often $75 to $100, ER copays between $300 and $400 unless admitted. Coinsurance is typically 20%, meaning that the employee pays 20% of the medical costs and the insurance pays 80%, up to the maximum out-of-pocket. The out-of-pocket maximums are between $7,000 and $8,500 for single coverage. Annual total premium costs are between $9,000 and $11,000 for single coverage, and the employee shares somewhere between $1,800 and $2,500 per year, which is about $150 to $210 per month. Whether those costs represent your costs or not, you'll have to look into, but that's what the averages are out there in the 60-something age group. Now, how does this compare to a typical Medicare package of coverage? Well, someone on a typical Medicare package has Medicare A, Medicare B, G oftentimes, and Medicare D. What are the average costs for those? Medicare A is zero for the vast majority of people. This is based on how long you worked. If you work 10 years or longer, under most cases, then you don't have to worry about paying any premiums for Medicare Part A. The premium for Medicare Part B hasn't been released yet, but let's assume it's about $207. The national average for G is about $143, but there is a lot of variability in this number depending on where you live. Medicare Part D averages about $47 per month right now, and so that brings the grand total to $397. Now, I will say that a lot of people actually don't do this exercise themselves. They might eyeball it, but they let a qualified Medicare advisor do the comparison for them. In fact, I would say that that is one of the primary jobs of a Medicare advisor. And whether you're enrolling in Medicare for the first time or you're checking your plans annually, a Medicare advisor should be able to do the cost comparison for you. A good Medicare advisor should also be able to make sure that you get the coverage that you need, you get your timing right so that you avoid penalties, and that you have the doctors and the hospitals that you're looking for. Now, everything we talked about needs to be done during the initial enrollment period. That's the 3 months before your birthday, the month of your birthday, and the 3 months after your birthday. But let's just say that you like your company's health insurance and you don't want to enroll in Medicare. Well, you can do that. You can forego enrolling in Medicare. Let's say you want to pick it up at age 67. You can do that, but the timing is a little different because your company may require you to enroll in Medicare during the company's open enrollment period. And for a lot of companies, that's between October 15th and November 15th, give or take a few weeks, with coverage starting on the following January 1st. The next Medicare mistake employees make working for a company of 20 plus employees is enrolling in Medicare Part A. It's free. Why not? The reason is that if you enroll in Medicare Part A, then you can no longer contribute to your company's health savings account. In fact, you can't contribute to your company's health savings account 6 months before you enroll. So if you plan to enroll 3 months before your birthday, it's 6 months before that. So a total of 9 months. You have to stop contributing to your health savings account 9 months before you start receiving Medicare. Finally, if you have a spouse who's younger than you or you have dependents on your company plan, you need to maintain your company plan because if you don't, your dependents won't have health insurance. The only option is to put them on an ACA plan, which typically is going to be more expensive, at least in most cases. But employers won't let you leave the plan and still keep your dependents on the plan. At least I've never heard of it. So what happens when you finally leave? You've decided it's time to retire. Let's say you're 67, or they've decided to retire you. You have up to 8 months after your employment ends or your employer terminates your health insurance coverage, whichever comes first. And importantly, Medicare Part D, your drug coverage, the window is 63 days after you leave your employer's drug coverage plan. The special enrollment period protects people from being penalized for delaying Medicare. Without it, as I mentioned earlier, you could face a 10% per year increase on your Part B costs and 1% per month on your Part D costs. Finally, if you claim Social Security early, that's under age 65, when you come upon age 65 and you're working for a group of 20 or more employees, the SSA will put you on Parts A and B. You can decline B, but you can't decline A. You fill out Form 1763 and send it to your Social Security office to decline Medicare Part B. Also, don't forget to give our partner Chapter a call if you have a question about Medicare, 440-703-1224. This is Jeff Schmidt, and I will see you in that video right there.